Yep, I think I can. Okay, we're live, and I think we are recording also because some people didn't have Facebook, so we're trying to see if I could put it on YouTube, and then they can look at it on YouTube as well. So let's hope all this technology, works. So good evening, everybody. It's Bob Duff. I'm here with Dr. Amy Ahasic from Norwalk Hospital. I hope that you all are well and getting ready for Thanksgiving and a very small Thanksgiving, everybody. Big turkeys, but small Thanksgiving, I think is kind of the way to go here. Interestingly, I heard a story on NPR about a month or two ago about how the turkeys are raised a year in advance, so they can't make them smaller, even though people are having smaller Thanksgivings. So therefore, everybody's going to have these big turkeys, hopefully with small gatherings. So there's going to be lots and lots of leftovers. And so by Monday or Tuesday, everybody's going to definitely have a turkey hangover for sure. But I think that's going to be okay this year. So we'll all be sharing our secrets on turkey soup, turkey pot pie, turkey fricassee, turkey. We'll all be gobbling ourselves after a few days. So anyway, all right. So I'm glad everybody's here. It looks like we have a bit of an audience. And so as I remind people that sometimes you'll see me turn, I'm looking at some of the questions that we may be getting, or just seeing if there's any conversations going on or anything else. I'm going to give a very, very brief update as to kind of where we are in the state right now. Then Dr. Ahasic, I'm going to ask you some questions, and then if we have some time, we'll get some questions from the audience. But I thought it was just a good time right now to just get an update. We haven't done this in a while. Yeah. And, we went down to almost zero, or, fewer than 100 hospitalizations in the summertime. People were outside there, everybody's doing the right thing. And now we knew that when it got colder, it's going to be a little more difficult. So here we are. So in the state of Connecticut today, we have a 4.83% positivity rate over the weekend. That's 5,271 positives out of 106,740 tests performed. Over the weekend, there were 43 COVID-related deaths in Connecticut and 27 more hospitalizations. Total deaths in Connecticut are about 4,671, and hospitalizations are at 875. In Norwalk, as of yesterday, there were 4,166 reported cases and 155 COVID-related deaths. In Darien, as of last week, there were 418 reported cases and 5 COVID-related deaths. So we are in a different spot than we were just a month or two ago. As I like to tell people, we are really back to March and April numbers, though it's a little different right now because there are different treatments. We know a lot more than we did back then. I mean, just imagine, just in a few short months, it's different right now in a sense that with the numbers as high as they are of infections, I think there are probably fewer hospitalizations than there were back then, and probably fewer deaths, but still, nonetheless, we're going to be having around the state of Connecticut, there are 4,871 fewer people at the Thanksgiving table this year than there were last year. And so we have to keep that in mind, and which is the reason why we need to make sure we have smaller Thanksgivings. If for my household, it's just going to be the 4 of us, Tracy, me, and the 2 kids. My parents are going to have their own Thanksgiving. And I know a lot of others are going to be doing the same thing too. So Dr. Ahasic, kind of just give us a sense of where we are, you think, and what we should be doing, what we should be thinking about, and what are you seeing at the hospital?
Yeah, so I think you summed it up well, that actually our numbers are back to really where they were in, say, April or May. It feels a little bit less acute because I think it hit a little slower, and we've been preparing for it all summer. And lately, a lot of the cases have skewed a little bit more toward the younger population. So I think, like you said, a little bit lower in terms of hospitalizations or, critically ill people, because it's less the older group and more the teens and 20s. But that's one of my concerns about Thanksgiving. And exactly what you said is the younger people exposing the older folks, and obviously outside of the holidays as well. But obviously big family gatherings would be one route for that. So I worry that a week or two after Thanksgiving, we may see a spike in cases in older adults as well. And those are obviously the people at higher risk for severe disease and death. And, we are certainly seeing that rise at Norwalk Hospital. I mean, like you said, we had 0 or 1 patients for a good while, and now we have a steady stream, very similar to everyone else in the state. And I think we have learned a lot. Like you said, we're doing very different treatments and things than we were doing in March when we knew so little. But a lot of it still is supportive. So really the best treatment is not getting it, which is doing all the things that we talk about: masking, lots of hand washing, avoiding, contact with people that you don't need to be in contact with. As hard as that is over the holidays, I think it's unfortunately going to remain really important for us.
Yeah, how does just from a standpoint of, back in the beginning, we weren't masking at all. That wasn't,
Right.
because we were fighting for PPEs for our
Right.
first providers and healthcare workers. Then everybody started making cloth masks, and then the supply opened up a little bit for that. Tell us a little bit about, when you talk about masking and hand washing, because we had talked about the hand washing and social distancing since the beginning. Talk about really the benefits of if everybody's masked. What does that do? How does that help?
Yeah, and some of you may have seen graphics about this too that I think are really accurate and helpful. If I'm masked and I have COVID, I'm preventing you from getting the droplets from my mouth and nose, which is where COVID really lives. So I'm protecting you. If I don't have COVID and I wear a mask, I'm further protecting myself by even further limiting any exposure to somebody I may come in contact with that I don't know has COVID, that may be asymptomatic or, I'm just not aware of. So, there's benefit to either person being masked. There's absolutely additive benefit to both people in an interaction being masked. And you're absolutely right. I mean, even in the hospital initially, we weren't all masking all the time. And now, other than me being alone in my office right now, I mean, we are masked always outside when we are with anybody, except perhaps when you're eating or drinking. And then even then in lounges, trying to separate people so that you're not eating and drinking close together. And so that seems to be such a key and really may help even decrease cases, of course, but even maybe decrease severity of illness, because maybe if you get COVID, but you're masked, maybe you got a less dose, lower dose of the virus. So maybe you'll have a less severe disease. And, we don't quite know that yet, but I think, the COVID literally comes out of your nose and your mouth. So if you cover them and that's covering your nose and your mouth and not having your mask below your nose, it's very effective. And the hand washing is like the boots and suspenders, right? I mean, it's very effective. So soap and water, any hand sanitizer with a typical amount of alcohol, which is like 60 or 70%, very effective. And the other thing I would add is if you're in a multi-person household or you're at a workplace where you are with other people, cleaning of high touch surfaces. So places that lots of people congregate, wiping them down frequently. You don't need fancy cleaners, really anything typical is effective, just as sort of an extra layer of protection. But I think masking clearly is probably the biggest, most important thing for preventing spread within the community.
Yeah, and I think you're right about that. I mean, because, people talk about we all have to go shopping or, go out at times. And I don't know if the science is settled on how long the droplets last in places, right?
Right.
And I'm certainly happy and willing to listen to whatever the latest is on that. But where also are you seeing some of the greatest spread at this point?
Yeah, and it seems to be largely in, like lately around here, we've seen it with sporting events. So sporting, youth sporting activities, right, which I think has led to that ban in like club sports and team sports, because it definitely has been seen in those settings, even outside, right? But people are close together, they're breathing hard because they're exercising. So even though they're outside, which is a little bit of a layer of protection, but it really isn't enough. And still social gatherings, people getting together for parties, getting together for weddings without masking, absolutely are the things that are the biggest. There's obviously lots of sporadic cases because now we have more of it in the community, but clearly those events are still the major sources of spread. And then the people at those events spread it on and on and on, right? The cascade from there.
What kind of sports are you seeing it? Is there a particular sport?
No, I wouldn't say, I think team sports in general, right? So it's mostly youth sports around this time of year. It's football, soccer, et cetera. Because as much as, people are really not masked while they're playing, it's really the athletes, it certainly can be participants too, but I think it's really the athletes being close together when they're breathing hard, when you're exercising hard or playing a game, you have more air, you have more droplet coming out when you're breathing
Right.
times a minute. So the spread can be more, even though you're outside.
Well, as a former, I guess I'd like to get back on the ice, but hockey player, there were major spread amongst hockey teams, and
Yeah.
I'm
And
like,
inside, right?
I'm like,
Yeah.
yeah, because you get off the ice, and if you've been doing the right thing, you're like breathing like crazy, and you can see your breath
Right.
coming out all the time, and same thing with any other sport, really. It's the same
Right, but
issue.
then you go off the ice and you're packed together in in a small
Yeah.
area, and you're inside, even though it's a big, arena, it's still usually inside in many places, right? So,
Right.
Absolutely, ventilation is not always the best.
Exactly. Can you get it? Can it go if it spreads in your eyes? Is that another form where it can go?
It is, and so I think it's maybe a little unclear how efficient that spread is, how easy it is. But I will say that here at Norwalk Hospital, as well as at many other hospitals, we have really started to put much more emphasis on eye protection. Like I have my goggles right here. I have other ones too that kind of wrap around. And this isn't necessarily a huge thing for community people with very casual exposures, but when you're in a more high intensity exposure, especially if people are really coughing in your face who have COVID, I mean, having that extra protection for us
Yeah.
is becoming more clearly a piece that we need to cover too.
Yep.
So while I don't think everybody out in the community needs to go out and buy goggles, because it's much less of a risk, it is a possibility for sure.
Yeah. And so, there's a lot of testing going on right now. We have testing at
Yeah.
Veterans Park. We have testing on Saturday at Brian McMahon High School. I know there's testing all over the state, lots of lines, obviously. It's almost like early this spring, there was not enough testing, and there's lots of people who probably want to get tested. Now we've got lots of tests, it seems like, and it's just difficult for people to get into these tests because it's just,
Right.
It's we just need more people, and and everybody. I just want to say that people at the community health centers and folks at Veterans Park, and I know it takes a lot of time, but people are working really, really hard, especially at Veterans Park under very difficult circumstances. Imagine standing there in that wind all day, testing people, and freezing all day. But they're really doing great work, and we appreciate it. But so my son just came back from college. He's going to be quarantined for 14 days,
Right.
At least. And what should we be? How often should people be testing? I had also heard too that sometimes people they think if they've been exposed within 4 days they should get tested, but maybe it's now 8 days because things are mutating a little bit later because the virus changes. And so, I just want to let people know that, this is not a static virus that is going to be the same back as it was in March or April as it is now in November, December. Things change a little bit, and that changes some of the ways in which we address it. But walk through that with folks about testing, and kind of maybe is it a false sense of security if they get a negative back?
Yeah, I think it's a really good question and really important now, because as you mentioned, although we have lots of testing, there's still right now a big uptick in the volume of people who want to get tested. So in terms of being able to get in quickly, it's been harder. And I think part of that is people wanting the comfort of a negative test. But the truth is, if you've been exposed, you can't test out of quarantine. So if you get tested and you don't have symptoms and you're negative, you don't get to stop quarantining, because it doesn't mean you couldn't become positive a few days later. And so you're not going to test every day of those 14 days. And so for the most part, we're really encouraging people not to get tested unless they have symptoms and just to quarantine. And again, I'm talking about people who've been exposed. However, there are some situations in which people might need or want to test that is appropriate. And that's where you really just have to talk to your healthcare provider, your doctor, and that's where, virtual visits and things like that are really useful if you've been exposed, but you have these questions. But I think there can be a false sense of security. Also, people wanting to travel for Thanksgiving and thinking, oh, if I just have a negative test now before I fly, I'm good. But you're still exposed to the travel, the airplane, or, the people once you get there, and you don't know if they've been exposed. And so I do think it's false sense of security. And while it can be helpful to prove that you're negative, I think right now with so many people who are symptomatic and sick, it's hard to have the influx of people who are asymptomatic also kind of vying for testing. And hopefully we'll continue to ramp up availability and have plenty of testing for everybody. But I think the summary for me would be, if you've been exposed, you can't test out of quarantine. You still are going to have to quarantine for 14 days. So if you're, so if you're negative, it doesn't help you in a lot of ways.
Right.
There are exceptions to that with exposures and people in your life that you can't isolate from, but talk to your healthcare provider about testing.
I mean, I view a COVID test as a point in time test.
Exactly.
And it doesn't mean that now you're safe, you can do whatever you want, and you'll never get it because you've been tested.
That's exactly right.
So, if you've been exposed, wait, the 4 to 8 days, whatever the recommendation is to then put you quarantine and then get yourself tested. And then that really is a point in time test. And then we have to, my sense is that, and I don't know where, maybe you can talk about this a little bit. The best testing, I think, will be at some point when there's home, daily rapid tests. Before you walk out the door, you swab your nose or spit in a cup or whatever you do, and within 10, 15 minutes you're positive or negative, and it has a high success rate, of being telling you the right thing. So, do you know where any of those are at this point?
Yeah, it's exciting how much things have ramped up. And I think saliva testing in particular being something that is really promising and has been used in hospitals and things, but I think it's more and more going to be available in the community and other forms of rapid testing. There's also, we rely on the PCR type testing, which is the testing that really looks for the genetic material in the virus to confirm that it's present. You may have also heard of the antigen tests, which are a little different and typically a little bit lower sensitivity, but can be really helpful in bigger populations where you're really trying to screen on a regular basis, like maybe a university or things like that. And so there are different types of tests that are useful in different situations, but I think the home testing option, in particular, if people are able to do it on a regular basis, will be really helpful. Because just like you said, let's say you are exposed to COVID or you think you might have been, it is very unlikely that you're going to test positive in the first couple of days. So there's really very little point into testing at that point. And it's this whole period during this window, right? 14 days is kind of an outside, but it's possible. And so it's like that point of time of where are you? And if you could have the opportunity to look at several points in time, it may be more helpful. So hopefully that will be coming soon. The testing technology is definitely there. It's just really more getting it out and producing it, making it affordable, accessible, et cetera, which is kind of the stage that I think we're hitting now.
Yeah, right. I getcha. And then I want to get a bunch of other things I want to get onto. What are you seeing for the flu or cold, things like that with people masking? Because I had heard that there's actually less prevalence of the flu right now, though we still encourage everybody to get their flu shots, and Norwalk Health Department's having a drive-through or drive-in clinic tomorrow. It's on their website. You still get them at all the different drugstores, things like that. But what are you seeing with any of those ancillary diseases with the masks?
Yeah, so it's a great question. And I think one thing we are hopeful about is that in the summertime, countries like New Zealand and Australia had really low rates of flu during their peak flu season, their winter, probably because of all the quarantining and masking, et cetera. We hope that translates to what we will see here. We not guarantee that will be what we will see here. And so absolutely we recommend the flu shot. So certainly everybody knows the flu shot is not 100%. It does not completely guarantee you will not get the flu, but not only can it make the disease less severe, but it can prevent the flu. So kind of not to have both problems, right? The flu and COVID, not to be susceptible to both, I think is really important. So, right now it would be early for us for most flu seasons. It's kind of, late November into early December, and a few years in the recent past, it's been peaking in March. So still, not quite known, because I think we're a little too early, but we really have not seen flu yet. Again, though, it's a little early, so we'll see. And I got my flu shot. My whole family's gotten their flu shot. I highly recommend people get their flu shot this year.
Yeah, you kind of figure it's like if you get the flu shot, you're masked, and you wash your hands a lot.
It's like all you can do, right? It's
like the trifecta of protection.
Yeah.
Yeah. And we don't want we don't want to overrun our hospitals or our healthcare workers, which I'll get into that in a little bit. And so that's, we're all in this together, and we've talked about that a lot. We want to try and help and everything else. So before we get into the vaccines and where that may be going, do you have any more information on if somebody did get COVID? And there was an article in yesterday's Hour, it might have been in all of Hearst Media, but people who've had it, some people have died, unfortunately, but who've had it, and it's not like a flu or a cold where you get it and then you're within a week or two you're done, you're back to normal. A lot of these folks who are younger, I say younger in a relative term.
Me too, increasingly.
Right. Yeah. And 70s looking young these days. No.
Yeah.
But it's a long road to recovery. Some are, they say 80, 85% back to normal. They still have breathing issues, other kinds of issues going on. And, so there's quite a bit of concern out there if you do get it, and the long-term effects, which we didn't know, but we talked about that way back when. Do you know if people, if they do get it, whether they're asymptomatic or symptomatic, whether they can get it again, or is it like a flu where you may get it again, but maybe less depending on the strain? Does this have different strains to it?
Yeah, no, it's a really good question. And like you said, like all viruses, they do mutate in small amounts, as they spread, even within a season. So even though the strain, so to speak, may be the same, there may be small differences within a virus to virus, and that can change across the season. There have been several reports across the world of people who have had confirmed reinfections. So we know that COVID testing and particularly this PCR-based testing, which can detect really any virus, even if it's dead, that can persist as a positive for even up to like 90 days. That's side for most people, but that has been described, and that's typically not considered to be a new infection. But there have been people who've gotten sick again later, and through some pretty cool science about actually being able to test features of the virus they had at one point and the virus that they had at the second point, realizing that they are different viruses. And again, these are more in research settings to be able to confirm this. So it hasn't been a lot of cases. It's been, handfuls of people across the world, but it definitely appears possible, which is, perhaps a little depressing. But we do know that, a lot of normal, healthy people should have a really good antibody response, and hopefully that lasts at least seasonally, like the flu does, maybe longer. And I think that's just because this literally only been with us for less than a year. We still just don't know that the sort of the length or strength of immunity is still, I think, an unknown that unfortunately I think only time and research will tell us, and probably is going to vary person to person though too, depending on how severe your disease is, how much you respond. And you're right, there's these, I think the term long hauler has been used. We've definitely seen those patients with persistent respiratory symptoms for weeks to months. There have been other things like neurologic findings and symptoms, and a lot of research going into what that is. Maybe it's actually some, what we call sort of an auto antibody. So instead of a good functional antibody that fights the disease, you're actually fighting yourself. But a lot of, still knowledge not known there, but it's definitely real. We're definitely seeing things like that.
Are you seeing anything different as a pulmonary doctor now than you were a few months ago, or is it basically the same? Because we're seeing, as you said, younger people are getting it more, and some of them are more asymptomatic than older people. And especially we're seeing older people who are, who have underlying health issues getting it more severe. And sometimes some people are already on end of life, and that this is, the final straw. But if we're now that we're seeing it with younger people from a pulmonary standpoint, do you see, what are you seeing?
Yeah, and I will say it's some of these long-term symptomatic people, they often are the younger people who may have had symptoms but weren't that sick, and then they just kind of don't get all the way better or have a lot of symptoms going on. And it's still not the rule, it's still uncommon, but it's definitely happened. And I've definitely seen that more, I think, in the younger people who tolerated their virus fine, but that just feel like they're back to normal after a few weeks.
Yeah.
And that, I think, for the older people, it's been similar. I think the good thing though is, I think with what we know, I think a lot of the older patients are really trying to stay home as much as they can, and I think that's the reason we've seen fewer of them in the hospital.
Right. I always joke that I have my parents on house arrest.
Yeah.
Keeping them in the house safe, masked on,
Yes.
and
Yes.
not letting them out. And
I know.
just
And like you mentioned Thanksgiving, I know I was planning to host our family, but similarly, we are just doing my husband and the two kids, right? And it's nobody wants to do that. It's not fun. It's the holidays, but I think it's just necessity at this
yeah,
point.
we all want to be together at the next holiday when we can,
Yes.
and not say, because somebody said this on TV. It's like, do you really want to be the person who, made somebody's seat empty at the next
Yeah.
holiday?
Yeah.
Nobody wants to carry that burden with them for the rest of their
Absolutely.
lives, and that's why we've got to do what we got to do. I'm very concerned about the traveling that people are doing this holiday, and which is concerns me a lot because of the fact of what we saw in the Midwest and I think it was South Dakota with the motorcycle rally that was out there,
Yes. Yep.
and that was a super spreader event. Now we're seeing that across all the states, and frankly, what I want to warn people about who are listening to this is that that event or those kinds of events where people are not masked up, they're close up, they're not taking the necessary precautions. This is not some game. It's not, it's just the flu kind of thing. We've, talked about all those kind of conspiracies for a long time.
Yep.
Is that the Midwest right now, and you said your family's from there, is really on
Yeah.
fire,
Yeah.
and in a negative way, in a really tough way. And unfortunately, the best analogy I can give is that it is heading east. It's almost like the city power plants that burn coal with their smog and their pollution are heading this, and it's all heading this way. So I personally, and you can, I'm happy to be corrected if I need to be, but I certainly do expect it to get worse before it gets better. And that's the big concern, is that by people traveling, by them having parties at their house, by not being masked up, by not taking the proper precautions, we're just making this so much more worse for ourselves.
Yeah, no, I don't disagree with that. And yet, my parents are in Wisconsin. My sister and her family are in Michigan, and Wisconsin in particular is on fire. And I think what's hard about that is there is so much that's under our control. A lot of this feels like we have no control, and it's scary, and it's sort of like this thing we can't see that we could be walking into when we go out the door. But again, the masking, the hand washing, the social distancing, they really do work. And so, the travel, like you said, it's one thing if you can sort of isolate the disease in one area and kind of stamp it out. But if people are traveling back and forth and, across the country, you just lose that control of being able to do that. And, and travel had really died down so much, but I think people are getting antsy, and especially with the holidays, people are taking the chance. And it definitely comes with risk. Like you said, it's my parents always say, it's like the weather, right? So 2 days later, we get whatever they had, it's coming, right? It's sort of the same wave. And, even though we went from positivity rates of, less than 1%, now we're, 5-ish% a few weeks later. And that's a lot less than what Wisconsin's seeing. It's a huge percentage increase for us, and obviously impacting our hospitals, et cetera. So I agree with you. I think, non-critical, non-essential travel, just don't do it if you don't have to.
I think, a lot of us can see a light at the end of the tunnel. Now, it's a very faint light and a very long tunnel, but it's there, and it may take a year to get there. We don't know.
We don't know.
I'm saying a year because you don't want to say, well, it's going to be, next spring, because we don't know. By the time all, people get vaccinated and there's maybe enough herd immunity, we don't know.
Right.
But I'd rather keep everybody safe than risk, otherwise. I mean, today's positivity rate in Connecticut is 4.83. That will be the lowest number of the week. It will only go up this week. So don't be surprised if it goes up over 6 or 8% this week. Now, that's a guess on my part, but I know for a fact today's number will be the lowest number. And so remember, we were down below 1% before, and with those numbers and with everything creeping and with all the traveling that's going on, be prepared over the next 2 weeks to have even higher numbers than that. So,
Yeah.
Governor Lamont, I think, has tried his best to not close things down and taking various responsible steps, difficult steps. And I always say that we're making the worst, making the best of the worst decisions.
Yeah.
Because these are tough. All these are tough decisions. They're not ones that anybody wants to make.
Yeah.
But if the numbers keep going higher, you got to follow other places and do more measures to shut things down. So can you tell us a little bit about kind of where we are with the vaccines? What's Norwalk Hospital and Nuvance Health doing on research as well? And what do you because you're doing your own thing as well as all these other companies doing the vaccine tests and trials.
Yeah.
And what are you seeing kind of that big picture wise there?
Yeah, so I'll start with the vaccines. I mean, I think, we've known that there have been several in the pipeline for a while that looked promising, and there are different types of vaccines and exactly how they work, but they all have very good science behind them. And I think what's been impressive to me, other than I think the speed of which they've been developed, is the efficacy numbers that we're seeing honestly are much higher than I ever expected to see. So to me, that's incredibly hopeful that we may really have that light at the end of the tunnel. Because, if we're looking in the 90+% for efficacy for the vaccines, and even if it's like the flu shot where it might just sort of attenuate or make the illness a little bit more mild, that too would be an incredible benefit to us. And it looks like some may be available soon. We're kind of preparing for that for when that's available. There are different types that need to be stored at different temperatures, some very cold, some medium cold, some not that cold. So trying to figure out the logistics, which I know the government is also obviously doing and our state is also doing. So we're preparing for that because I think once we have it, we need to be ready to deploy it and vaccinate people and use it. And I think hopefully production will continue to ramp up. That's what we expect, but it will take some time. It's going to start with some, and over many months we'll see more and more people can get vaccinated. In terms of research, I think there are a lot of exciting things going on. There were a lot of trials that happened fairly quickly with particularly medications we were using. But now that we've had a little bit of time and, to kind of organize things, I think there's, more, I don't want to say better, but a kind of a little bit, less rushed research going on. We are definitely involved in clinical trials, both treatment and prevention, outpatient, et cetera, like plasma, for instance. We're involved in a big trial looking at convalescent plasma. And if you're interested in any of that, that's all available on our website. You can look up those trials. But I think research is so important because I think we rush so much wanting to take care of the sick person in front of us and give them anything we can to make them better. But we honestly have not known what that is for a lot of this time. And we need research to tell us, what the right things are to do and to make sure we are helping people with the medications that we're giving them and the treatments we're giving them.
Well, it's all with the best intentions, obviously, of trying to do what you can, just flying blind a little bit or building the airplane as you're in the air kind of thing.
Yeah, exactly.
So just on a, and we'll see with the vaccines, what's it going to take for you, somebody in the medical profession, because you'll be the first ones to get it. What's going to make you feel safe and confident about getting a vaccine?
Yeah, that's a really good question. I think, the good news is that, the development of vaccines and the science has changed in terms of how good we are at making them, but really the process is not new. And so in terms of how vaccines are developed and tested, really with really looking primarily at safety, right? Are they safe? Do they make people sick, or do they work preventing the virus? That process is not new and is very well developed. And so I have a lot of faith in the study of these vaccines and knowing that if they, if they have good efficacy and they have good safety, they've been vetted appropriately. I think it's always a little tricky when things are rushed and we have these emergency use authorizations, but I really do trust in the process of developing these vaccines and the ways that they are tested. So especially given the efficacy numbers that we're seeing, I'm ready. When it's available, I am ready to do it. And I think we're really lucky to have several in the pipeline that all look promising and effective.
Yeah, it's to get a vaccine 3 different companies to have these vaccines with 95% effective rate, efficacy, is really very impressive. You know.
And I think, you know, some, because they work a little differently, some may require booster shots, some may not, et cetera. And all that's going to be, you know, we'll learn over time, but they all are looking very effective, so that at least in the short term, you know, we'll have options to start, you know, creating immunity in the community.
Well, it's better than where we are now, right?
For sure.
Yeah. So just on a standpoint of somebody over Thanksgiving or the holidays coming up, you know, numbers going up, and I think there's different visitor policies now for folks who have somebody at the hospital. But if you know, somebody's not feeling good, is it okay to go to the hospital?
Yeah, it's a good question. You know, I think we, along with many other hospitals, have really put so much energy into safety protocols to make sure people can come. Because I think one of the unfortunate things we saw in the first wave is that there was a period at which there was nothing but COVID in the hospital. So you know that lots of other people who were very sick were at home and were not getting care. And we saw the effects of that later, you know, people presenting later, presenting sicker with other diseases. And that is really something that we all want to avoid. Even in the emergency room, the precautions are, you know, incredible. And it may feel intense if you go there, because you're going to be treated kind of like you have COVID until we know you don't. But that's how we're going to keep our staff safe, and that's how we're going to keep you safe. Similar in the outpatient arena, I think, you know, we're still doing a lot of in-person visits with similar safety protocols, lots of screening. But, you know, remember that virtual visits are an option too. There's, you know, pretty much everybody in our system is available to do virtual health. Don't be afraid of it. Probably the crowd who's seeing this on Facebook right now is not the crowd who's afraid of technology, but 90-plus-year-old patients successfully do telehealth visits. And so there are some limitations in terms of being able to do a full physical exam, but there's actually a lot we can do. We can observe, we can discuss, and so they are really useful. And particularly if you're not feeling well and you're not sure if you really should go get a test, if you should go, you know, expose yourself to other people, that's a great time for a virtual visit to talk to your doctor about how you're feeling and could this be COVID, et cetera.
Right. Yeah, I mean, the telehealth law that we passed in Connecticut was such a, you know, for years we had debated it, and then the governor did it by executive order, then we did it by legislation, and it expires next year. We've got to re-up it again. It is a game changer, and frankly, for places like the Norwalk Community Health Center and Day Street Community Health Center, and even AmeriCare is in Norwalk on South Main Street. I think they're all doing a lot of telehealth, and it's making people, actually there's a lot of confidence in that, because people who normally may not go to the doctors or may not have access to go to get medical help are able to get medical help. So we want to continue to keep telehealth.
For sure. And I think, you know, traditionally, like Medicare, for instance, they had limited telehealth to people who are really geographically isolated. Like you can't physically get access to the doctor. They have waivers as well for the pandemic. So that's not an issue. And many other insurers have followed suit. And we are lucky in Connecticut to have support from the state in that regard. But for now, it is much more widely available and has really been rapidly adopted. So it's a really important option to consider.
Well, it's like voting. The more you open it up and you expand access, the more people participate. You know, so it helps, it makes more people participate by giving them more options, you know, to do it. And
just don't avoid, you know, the healthcare that you need. You can't wait out the pandemic. So, you know, just, you know, see your doctor in whatever way that means.
Exactly. Well, I just want to, and again, I want to thank you so much for taking the time. I'm going to ask you one last question, and I've had a really good group here. I haven't had any questions come up that I can see as I'm looking at my iPad, scrolling down.
We're answering all the questions already.
Right. But I just wanted to generally, again, because, you know, as we see these surges and we know that there's going to be more people being infected and the numbers are going to go up, you know, it's really important for us to think about, you know, how are our first responders doing? How are the folks at Norwalk Hospital or New Vons Health or any of the hospitals around doing? Community health centers, I mean, the Norwalk Health Center, everybody is exhausted. We've been pushing people now since March. People are working harder, and, you know, I know a lot of people at home who are not in the healthcare business are working harder because everybody's on Zooms all day and between their kids and everything else. But imagine being a healthcare professional where you're literally trying to save lives all day. People are burnt out. you know, how, just from a context of what you're seeing and what's going on, how are they doing? Because we really
Yeah.
want to make sure that we are, you know, when people make decisions about traveling for Thanksgiving or going seeing their friends, or, you know, sometimes making decisions that may not be in the best community-wide health.
Yeah.
What message, how are folks doing who are doing this each and every day?
Yeah, no, such a good question. I mean, it has been exhausting. It's been something none of us have ever experienced. And like you said, you know, even though we had the lull in the summer, it wasn't zero, and we knew this was coming, right? We knew it was happening, and we've been preparing for it. I think obviously we're driven by the mission to serve our community and serve our patients, and that has not changed, and we are ready for you. But, you know, I think as much as people can be good neighbors and try to do what they can to mask and hand wash and prevent spread within the community, helps so much and helps keep the people at the Thanksgiving table, like you said, for next year. And I mean, we're lucky that we've had such incredible support from our community. I mean, the generosity of our community has been amazing, and the support that we do feel, that we still feel it, appreciate it so much. But it is true that I think the best way to support us is really to try to do what you need to do to help prevent spread within the community. You know, it's not going away anytime soon. And I think that's the hard part, is that we know we're not going to be out of the woods for a while. This is going to be continuing. And it's like you said, it's first responders, it's doctors, it's nurses, it's respiratory therapists, it's, you know, everybody, right? It's the janitorial staff who have to go in and clean the rooms of the COVID positive patients, et cetera. So it's a huge group of people impacted, and this is hard on everybody. You know, we know that, but you know, keep us in mind when you put your mask on when you go out the door.
Right. Any final thoughts at all on anything, Dr. Ahasic?
I think stay safe, give thanks for what we do have. You know, keep your Thanksgiving small, but, you know, like you said, I think there really is a light at the end of the tunnel. It's going to be a little while, but if we all do what we need to do and do the small things that are in our power to do, you know, we're going to get there.
Yeah. Keep your turkeys big and your Thanksgiving small.
And I got a turkey breast. My husband actually did, because I was working, but 6 pounds. So I assume it was a very large turkey, like the one I heard that same story. So, you know, hopefully that's one solution, because I don't think we can eat a 16-pound turkey.
I know. Well, my issue is I've half our family. So my wife and one of my sons does not like turkey at all. So that was, for my wife growing up, the turkey was always the afterthought. It was always the macaroni, the soup, kind of more the Italian side.
Yes.
And I take more of the American side. I like the turkey, the stuffing, all that kind of stuff. So.
Oh yeah.
But there's still a limit on any of how much turkey anybody can eat without starting to gobble.
Yeah, the freezer.
Exactly. But so anyway, I want to thank you again for taking the time during the very, very busy time for you and for folks at Nuance Hospital. Thank you for agreeing to this and coming back. Last time you were a very, very popular guest. So so you were my first person to ask to come back. And I want to wish I appreciate it. And I want to wish everybody who's watching this live or on rerun a very happy and safe Thanksgiving. Please consider your safety, your family's safety, and the community safety while you are doing Thanksgiving or anything else that you're doing. Whether you're shopping, please do one per family if you can in the store. If you don't have to go out, you know, don't just wander out for no reason. If you see a lot of people walking, go on the other side of the road or mask up or something like that. So just take all the precautions you can. Think of all the healthcare professionals who are working on Thanksgiving Day and to make sure that we're all safe. So thank you, everybody. Have a great night. Have a good Thanksgiving, and we'll see you next time. Thank you.
Thanks.
Bye.